We'll get to discuss examples of what trematodes. And these trematodes are also known as what flukes. If you hear people talking about flukes, they're actually talking about what trematodes, right? And these flukes are also known as what leaf-like worms. They are like leaves. They are as flat as leaves. Okay. So I'm talking about the trematodes. We'll be focusing on the types of trematodes, and we're talking about the transmission. We're talking about the symptoms that if these organisms cause a disease in you, okay, what will be the symptoms? They'll look at the diagnosis, then possible treatment and prevention, okay? So looking at the trematodes, see that what? Trematodes are also known as flukes. They're a class of parasites. Okay, they're a class of parasitic flatworms that infect humans and animals, right? So looking at the types now, which we'll be looking at the types, like each of them I'll be picking them to make a video on them. All right, so liver flukes examples is what? Fasciola hepatica, Fasciola gigantica. Lung flukes include what? Paragonimus, westermani. The intestinal fluid include what? Fasciolopsis, buski. Blood flukes include Schistosoma mansoni, Schistosoma japonicum. All right. Then liver intestinal flukes include what? Opistochis, what? Viverini. Okay, all those ones are liver and intestinal flukes. All right. Transmission. These organisms, how are they transmitted to the human to actually cause a disease condition? Through contaminated water or food. All right. Or sometimes when you consume an intermediate host, which could be snails or fish. All right. It could be that the fish and snail was undercooked. All right. Was not processed properly. Then also you could get it from direct contact with infected animals or their feces. Alright, you can see this is a liver fluke. Look at the picture very well. See how it is. Alright, so symptoms. Liver flukes could cause things like what? Abdominal pain, diarrhea, weight loss, fever. Lung flukes is now affecting the respiratory tract. Okay, so it causes things like cough, chest pain, hemoptysis, dyspnea. Intestinal flukes now, yeah, steep diarrhea, abdominal pain, weight loss, malabsorption. Blood flukes now affecting the blood now, cause things like hematuria, where you're now urinating blood in urine, okay? Then dysuria, you're having pain on urination. Having fever, you're having what? Abdominal pain, okay? Diagnosis, you can confirm an infection from this organism by a stool examination or urine examination. Imaging studies could help. Serology studies tests could help. Biopsy or tissue examination could also help. Treatment. Antiparasitic medications like what? Triclabendazole or praziquantel. Okay. Supportive care like what? Hydration or rest. Surgical intervention in some cases could also be useful, right? So prevention, since you can actually get it from intermediate hosts by contaminated food or if they are under process, just make sure you properly handle and cook food very well. Avoid contaminated water or foods. Wear protective clothes or gloves if you are being exposed to what? Contaminated water. Okay. Then regular deworming of animals, right? So here just lists examples of these trematodes again for people who want to make a mnemonic or memorize it or anything. Okay. So I think that's it on the note on trematodes or flukes. Trematode worms, also known as fluke worms, right? Also known as flatworms, are a type of what? Parasitic. Okay, spoke about the types, the transmission, symptoms, the disease caused by them, and all that.